Dr. James Southwell-Keeley from Darling Point, who's a plastic surgeon who's come to lift the veil on all things plastic surgery and explain what everything is. Now, welcome.
Thank you so much.
So please explain to us, how do you choose the right plastic surgeon? I mean, we all have seen the stories on, 60 Minutes of these cowboys who are posing globally as plastic surgeons, and they're not. So please tell us, how can we foolproof ourselves and make sure we choose the right person when you're not available?
Very good. All right, well, qualifications and word of mouth, I think, are the safest means to choose your plastic surgeon.
Now, hang on. Word of mouth in the eastern suburbs. I don't know a woman in the eastern suburbs who will ever admit to having any injectables. So there's no word of mouth going on around here, James.
There's sometimes a special friend, maybe there's a secret handshake, something like that.
Shall I start a website?
Possibly.
The secret handshake.
That's right.
Who we recommend.
There you go.
But what qualifications do we look for to make sure that it's the right person? Is a nurse okay, for example, to inject my face?
Look, technically, a nurse under supervision of a doctor is okay.
Okay.
As to the letter of the law.
Because that would be a bit cheaper, right?
It is a bit cheaper.
Right.
Yeah, 100%.
Okay.
Yeah. My personal opinion is that you want the person doing the injection or applying the therapy that can deal with any problem that may arise.
Absolutely.
Yeah.
So how many years of study have you got? You were telling us earlier.
Yeah, that's right. My gosh, tires be thinking about
16 years or something?
about that.
Globally, Paris, London, Lyon.
Yes, all of those international centres, because they do things slightly differently over there. Ultimately, the pool of medical knowledge is the same,
Right.
but the nuances are different.
Well, on that global scale, why are people going to Thailand and South America, and why are things so much cheaper there? Is that just an economic thing, or is
It's
it
an economic thing. It's a really good question. So there's a question of labour cost, which is always cheaper over there. So the cost of running an operating suite, the cost of nursing staff, the cost of the trucks delivering the anaesthetic drugs, the oxygens, all of that, everything, all the infrastructure, everything is cheaper. And so you can fly over there and have your surgery and go home, maybe having had a little holiday as well, for probably 80% of the cost that you'd have it here.
How do you feel about that as a practitioner working in Australia?
Look, ultimately, it's up to you, the individual, to decide where you go, but this is what I'd counsel anyone who is thinking about that. After your surgery, you feel a bit low, you're in pain, you want that support. That's when you need the most love. And why be away from home? Why be away
100%.
from family and friends? So that's one reason I'd say do it locally. The other reason is, if you have a problem and now you're back in Sydney, 2 weeks ago you had your breast augmentation in Thailand or wherever.
Brazil?
What do you do? Who do you go to?
You've got to start from scratch then. Come to someone like you.
Or you
have
go
to work
to
out
the
what they've
emergency
done.
department at a public hospital, and when it unravels, it's a disaster. It's a disaster for everyone.
Have you seen some of those?
100%. We'd see, I work at St Vincent's Hospital in Leith-Manos, and I'd see, or the unit, plastic surgery department there would see maybe one case every 2 to 3 months.
Wow.
And all manner of different things: silicone implants in noses, infected breast implants, implants extruding from the skin, all sorts of
all of
horrors.
these people trying to look more beautiful and be happy within themselves and coming off second best.
Coming off second best, and as you alluded to earlier, it's always harder to deal with a problem than it is to get it right in the first instance.
So you pay the 20% more.
You pay,
to be
it's
sure.
always advertised that it's much, much less than that, but by the time you've added accommodation and
Sure.
travel insurance and all the other little add-ons that are never advertised in the advertised price, it ends up being not that much cheaper, but the risks are so much higher.
That's for sure. Now, I want you to look into the future and tell us how you see plastic surgery, injectables, the whole thing being a part of life. Because who would have thought 10 years ago that having Botox would be kind of, I don't know what the stats are. Is it 1 in 2? Probably. Well, 1 in 2 women over a certain age. It's so common.
That's a great stat, and I'm going to run with that.
But what do you see? I mean, are we all going to be lining up for a face job at 60 in 10 years?
Well, look, as the surgical techniques progress and as surgical technology and the medical knowledge increases, procedures become less and less invasive and the downtime becomes less and less. You're back to work, back to your normal social activities sooner. So
Signs get less, that you've had work.
signs get less,
Yeah.
absolutely.
Yeah.
And so it will become a more readily available and a more socially acceptable commodity, essentially.
Well, it's starting to already,
It's
isn't it?
starting to already, absolutely.
And can you ever see, someone, probably in America with all due respect, creating a pill that keeps us young? Do you think that's possible? I mean, there are people working on it.
There are definitely people working on it. I think we're probably many generations off that.
Damn.
I'm sure.
So our children's children, maybe.
Yeah, maybe getting close.
Might stay young forever.
Might stay young forever. Okay, so would you want to stay young forever?
It's a good question.
There's
isn't
a
it?
hypothetical.
And that's a question that's been addressed historically since time began. And I think, it's okay to get older.
It's okay to get older.
But I want to look as good as I can, as fresh as I can while I'm doing that.
Be the best you can be
100%.
through every stage of your life.
Yes.
Yeah.
And they think, what can I do to look younger? I'm single. I want to look good. I come to you. What's the process?
Okay, so it starts like this.